welcome to the third edition of Biochat at ISBP. Joining me today is Dr. Manoj Lakshmanan, Project Manager for Bioplastic Initiative from Zacros. So, Doctor, thank you for joining me today.
All right, thank you very much for giving me the opportunity to join.
Doctor told me today that she's a little bit camera shy. So this might be a good opportunity for you, I guess. Yeah. Okay, Doctor. So perhaps could you start by introducing Zacros Malaysia and sharing its key initiatives? I mean, like, what are you currently doing towards the sustainability in the context of bioplastics?
Okay. Right, thank you, Mr. Muzamil. So I will start with the brief introduction about my company, Zacros. So Zacros Malaysia is a subsidiary company under Zacros Corporation. So Zacros Corporation is headquartered in Tokyo, Japan. So we are actually a long timer. So we have been established since 1914. So this year we are celebrating 110 years of establishment. So we are, so previously Zacros Corporation is known as Fujimori Kogyo Co. Limited. So we just changed we rebranded. So we used Zacros as our brand previously, but we have completely changed it, and we are adapting to Zacros the entire time from 1st of October. So therefore our company name now is Zacros Corporation. And Zacros Malaysia is a fully owned subsidiary of Zacros Corporation, which is located in Shah Alam. So as for your question, for the Bioplastics initiative, it all began in 2021. So if we want to go back, Zacros is itself is a packaging company. So we deal with very packagings for targeted applications for healthcare, for various kinds of industries, construction, many other targeted fields. So having said that, we also deal with plastics a lot, and we found that some of our plastics are also ending up in the ocean. So in a way, we are also contributing to the pollution, plastic pollution,
especially
globally,
Malaysia,
right?
I guess.
Especially so Malaysia now. Malaysia is number one for microplastics consumption.
Okay.
So we top the list for microplastics consumption, and we are at the number 9. We are still in the top 10 for inhalation. So microplastics are also inhaled. So when it floats in the air, it's called a nanoplastic. So, and then the one that you find in the water body, which is below 50 mm, size of 50 mm, is called microplastics.
I see.
So, so as a result, we decided to invest to develop a new generation material. So then we were looking for a potential place. Then we found that USM, which was my previous university, my previous lab, which is Prof. Sudesh Kumar. So Prof. Sudesh has already established this technology for over 30 years. So Prof. Sudesh has been working on it for 30 years. So we decided to approach Prof. Sudesh in 2021. That was during pandemic, and I was still in Prof. Sudesh lab. So that's where we started. So we were doing a lot of lab works, and then from the lab scale experiments, we found that it is highly successful. Then we decided to go to a larger scale, slightly larger scale, which is a pilot scale. That's where we collaborate with Sirim. So Sirim is one of our partners now. So we invested and set up a pilot production facility in Sirim. So in Shah Alam.
I see.
Yes, in Shah Alam. So right now we are in the feasibility studies. So we because we cannot just jump into commercialization directly, right? So we need to test the waters.
Understood.
So so we are doing our part to test the market and to also develop potential applications and engage with the customers. So there are a lot of things that are going on in the background.
Understood.
At the same time, we are also optimizing the scalability, optimizing the scalability. So so once everything is done, so we are good to go to commercial scale, not directly to the like what other bioplastic players in the world is doing. So we will go stepwise.
Understood.
Right.
Understood. So you mentioned about a new kind of plastic. Can you tell us more about this plastic? And also you mentioned that you are currently trying to apply it on a larger scale production and larger scale manufacturing.
Right.
So could you also share us the challenges that lies in making it sustainable for large volumes?
Sure. So the bioplastic that I mentioned, it's called PHA. So PHA is a short form for polyhydroxyalkanoate. So this PHA is actually produced by microbes in the environment. So the mechanism.
So it's naturally available.
It is naturally available, but not in all microbes. There are some specialized microbes which if you stress that particular microbe, so they have a very special gene in the microbe which is called a PHA synthase gene. So this gene gets activated and they convert whatever carbon source that's around them, whatever carbon source that's available around them into bioplastics. So it is a type of polyester compound. So it is accumulated inside the microbial cell. So why? Because they use this component as their food in times of stress. So they will store it just like how we eat. You know, when we eat carbo, right?
Like
then we
stress
get
eating.
stress it. Then we get fat. So all the fats are accumulated in our body. So something like that. It's a similar concept. So they take up all the carbon substrates and then they convert into bioplastics and then they store them, and they use it up slowly for their survival. So we use that to our advantage because the bioplastic, the PHA that is accumulated in the microbial cell resembles our petroleum-based plastics. So the properties, so they are you can process it thermally and then they are completely biodegradable. So we use that to our advantage. We extract the bioplastics from the bacteria, and then we mold it into different products for different applications. So it can be used from daily necessities up to biomedical applications. So it has a wide range of applications and potentials.
I saw that at one of the PHA booths that there's some substrate that is fed to the mealworms.
Right.
Yeah, okay. And so perhaps you want to tell us how that works a little bit?
So that is one of our method to extract the PHA.
I see.
So, PHA itself, so it is produced, as I mentioned, it's produced by bacterial cells, microbes. So we start from the fermentation process. So the fermentation, definitely it happens in a bioreactor. So that's where the Serum pilot plant comes. So we do the fermentation there, and then we get the biomass, or we get the cells, we dry it, and in a normal scenario, the PHA is extracted using chemicals. So there are a lot of chemicals. So the golden standard for extraction of PHA is using chloroform and methanol.
Oh, okay.
So that is the very common, very conventional way of extracting PHA is using chloroform and methanol. But we do not want to do that because it's very hazardous to the environment and hazardous to human health. So in terms talking about scalability also, it poses a lot of risk. So this method using insect larvae, mealworms, was also discovered by Prof. Sudesh when I was working with Prof. Sudesh. So we discovered that the mealworm, which is a beetle larvae, it can eat up the cells and then it can excrete the undigested bioplastic.
Oh,
so,
okay. Interesting.
So they do the extraction for us. So we just feed them the biomass. They eat up the biomass, and then they after 48 hours, you see that they completely eat. They completely eat up everything, and then they digest the biomass, and we see all the excretions are full of PHA. So we just take it, and then we purify, and then we already have our product that we want.
Is it economical to do that?
Yeah, if you say in terms of economical feasibility, right? I mean, it is sustainable because in Malaysia we have a lot of mealworm farms, so we have mealworm players. So we just have to collaborate with them and provide our cells. So it's more like a zero cost approach. So they don't have to use their their common feed. So for mealworms, normally if you want to cultivate mealworms, you need to use oats, wheat bran, and all those kind of food materials. But we just have to provide our biomass to them. They use it as a food because the biomass itself is a source of protein. So it's more like a single cell protein. So the mealworms eat up and then they enrich with protein. So the mealworm farm gets an advantage. They don't have waste to collect because we will collect their waste. So the excretions is our valuable product.
So they don't have to pay for the food for the mealworms.
Correct.
And then don't have to pay for the excretion of the waste.
Exactly.
Because the waste is what you want.
Yep.
I see.
That's true.
That's a very conventional, very economical model.
Yeah, it is.
It is.
So it actually reduces the cost significantly.
Oh, okay.
Yeah.
Okay.
Yeah.
And then it's a win-win situation.
It is a win-win situation. So then it is also one of our zero waste production approach. So we are targeting to produce PHA in a closed loop system. So so we do not want to generate any waste.
I see.
So this is one of our approach.
So okay, perhaps for the last question, what are Zacros' strategic plan in implementing the usage of PHAs perhaps in the Asia Pacific region? Which market do you see that is very lucrative, I would say?
Okay, as I mentioned, we are currently in the feasibility studies. So this is where we are doing the market search. So we have a plan where we are actually targeting many areas. So one of it is for daily necessities. Plus, we want to like cutleries or plates, cups, and etc. So we will start with that. And then we also plan to go towards biomedical applications in the future because PHA itself has a broad range of potentials. So it can be used for daily necessities, for biomedical applications, etc. It can even be used for implantable devices.
Oh, okay.
But that is a long way to go. Yeah.
But since it is, you say that it is degradable, how does it fares as an implant?
Okay. When we talk about PHA, there are over 150 types of PHAs available in the environment. So one of it, which is called 4-hydroxybutyrate, is highly potential to be used for medical applications. So 4-hydroxybutyrate is actually resorbable by the body.
Oh, okay.
It can degrade in our body, human body. So that particular polymer 4HB is highly potential to be used as a medical device, as an implantable device to be precise. But PHA itself in general, like any like certain monomers, like certain types of PHA, it can be used as a wound healing patch perhaps, or for any external medical devices.
There's quite a range of application, I would say.
Correct.
Because the only one that I saw at your booth, perhaps the cooking cutleries.
Yeah.
But I never knew it can go this way.
It can go up to medical applications, but we are still far. We are still. There's still a long way to go, I would say, because for it to be used for medical applications, there are lots of. It must be completely safe, I would say. There must be a lot of certifications and endorsements from the government bodies and the international medical bodies and all. So we are still a long way to go for that. But the immediate application is definitely for daily use.
That one is ready right now, lah.
That is, I would say, is ready. But that's where the challenges comes.
Yep.
So because if you compare PHA with the normal plastic material, I have to be honest that it is still the cost of PHA is still at the higher side.
I see.
So not just our company, but there are a lot of companies and researchers are working hard to study about this to reduce the cost of production.
So that it is applicable to everyone.
So that it is applicable to everyone, and it can be a good alternative to petroleum-based plastics in terms of cost, because now petroleum-based plastics are way cheaper than PHA. So
perhaps just a little bit give us an idea how far does it stands against the conventional plastic?
How far means how long? Oh, okay. Currently, it's about 5 times more.
Oh, okay,
Yeah,
okay.
5 times
But
more.
considering that it is still in a research stage, that's
Yes,
good.
correct. It is
Yep.
still in the R&D stage. So now we have gone to the pilot scale, successfully gone to the pilot scale.
Oh, congratulations.
Thank you.
Yeah.
So with our strategies that we are working on, so hopefully we can bring down the costs further, so that it's comparable to petroleum-based plastics.
All right, right. Thank you so much. I learned a lot about PHA today. I never
Thank
knew
you very much, Mr.
that
Muzamil.
you can put it inside your body.
It can be. So
Yeah, it can be.
In future, you might find all the
Yeah.
medical products,
Oh, that's interesting.
PHA-based products.
Yeah, yeah.
Right.
I wish that day is not a long way to go. All right.
That's also my hope.
All right. Thank you so much,
Right, thank you,
Dr. Manoj, for
thank you
joining
very
me
much.
today.
Thank you very much, Mr. Muzamil.
So we shall see you very soon. Thank you.
Thank you.